Hello, everyone. I'm Lauri, the lead analyst for the Center for Research on Energy and Clean Air, a new global research organization focused on analyzing the trends, the sources, and the solutions of air pollution around the world. I've worked on a study on the planned coal expansion in the Thar region in Pakistan in light of the very large expansion of emissions that it would entail. The reason why we're concerned about the development of energy and emissions in Pakistan is that the country is already among the world's most polluted countries, according to a global ranking by IQ Air, the second most polluted country in terms of average PM2.5 levels. And PM2.5 particulate matter pollution, according to a range of authoritative global studies, is the largest environmental killer in the world and in Pakistan. The World Health Organization officially classifies it as a carcinogen and has called it a leading environmental cause of cancer deaths worldwide. And right now, of course, when we're in the middle of a global pandemic, an important concern is that air pollution increases the vulnerability of exposed people to the COVID-19 disease. Pakistan, as many of you know, is also in the midst of a very rapid expansion in coal-fired power generation. Almost all of the currently operated capacity was commissioned just in the past 3 years, and a further doubling of coal-fired capacity is in the pipeline, looking at proposed and under construction projects. More than half of these new planned projects are in the Thar region, where one of the largest clusters of coal-fired power plants in South Asia is being planned. And if this expansion is realized, it would become one of the biggest hotspots of air pollutant and mercury and carbon dioxide emissions in South Asia. Another reason for concern is that in the areas where this expansion is being planned, the current pollution levels already before the coal-fired power plants are in operation are extremely high. They are 2 to 3 times as high as the Pakistani environmental quality standards, and up to 10 times as high as the World Health Organization guidelines. And this is based on information reported in the environmental impact assessments prepared by some of the project proponents themselves. Oddly, this concern seems to have been completely brushed aside. There is no rationale for how you can justify major new emission sources in areas that already suffer from pollution that is far above legal standards. As part of this project, we also went through the environmental impact assessments that were available. Preparing an environmental impact assessment is obviously a key legal requirement for obtaining the permits and building projects with major emissions and environmental implications, such as coal-fired power plants. A couple of striking things about these assessments were that first, they claim to comply with international standards, namely the World Bank International Finance Corporation guidelines for emissions. But the limits that they apply are limits for so-called non-degraded areas, which these clearly are not, because they are in violation of the key air quality standards. So this statement about complying with International Finance Corporation standards is completely false and misleading. Another major thing that stood out was one of the environmental impact assessments underreported mercury emissions about 20 times. A very dramatic understatement of emissions, and it seems that this environmental impact assessment was just passed through. So these kinds of misleading and false bits of information in just those parts of the environmental impact assessments that we scrutinized seriously raised the question of what is the level of scrutiny? Are the permitting authorities reading these documents? Are they in fact executing any independent scrutiny, or are these just being rubber stamped as they come in? And for a country that is in the midst of a massive expansion of its coal-fired power capacity, lacking that oversight and lacking that scrutiny, that institutional framework to oversee this expansion is very alarming. So in the absence of proper environmental impact assessments, we carried out a detailed study of how these planned projects in the Thar would influence air quality, how they would influence human health, and how they would influence toxics deposition in these areas. So we started by building an emissions inventory for the power plants and the associated lignite mines, using, as far as possible, data from the existing environmental impact assessments and other available documents, publicly available documents, and generalizing based on those. So for projects that didn't have data yet, we generalized from assuming that their technology and their operations are similar to the ones that have already prepared those documents. Then we carried out detailed atmospheric modeling for the emissions, taking into account the height of the stacks, the kind of emission control technology that the project proponents say they would employ, and so on, and using a full year of hourly meteorological data from the area to look at how the pollution would spread in the atmosphere and how it would affect air quality in the region. And here it's important to note that we assume that everything that is said in the environmental impact assessments is true, that all the emission limits are followed, all the technologies are operated properly, and all the emission limits given in those documents are met. And if that's not the case, the impacts could be considerably worse. So then, based on these results on air quality impacts from these projects, we then looked at the population exposure, how many people live in the different places that are affected, and then we used existing scientific studies on scientific risk models that link air pollution levels to the risk of different diseases and different health outcomes. And we combined that with data from Pakistan on the current rates of death from different causes. This is a standard approach for health impact assessment. And the results that we found are alarming. The sulfur dioxide concentrations and the particulate matter concentrations from these plants would, in the most affected areas, exceed the World Health Organization limits, even without considering any other emission sources. So even if the air was completely clean, these sources alone would cause exceedances of the World Health Organization guidelines. And of course, in reality, as mentioned, the pollution levels are already high, and the impact from these sources would come on top. But so we find that approximately 100,000 people live in areas where just these sources would cause exceedances of the World Health Organization guidelines. The other very, very alarming thing that comes out of our modeling is the risk of mercury contamination. So these plants would emit around 1,400 kilograms of mercury every year if built and operated. And once released into the air, about 1/5 of that mercury would be deposited into the area. Most of that would go into cropland, creating the risk of increased mercury levels in crops. And the levels of mercury deposition that we found in the modeling are potentially dangerous in an area with approximately 100,000 people. The cumulative health impacts from the increased level of air pollution include an estimated 29,000 premature deaths if these plants are built and operated for 30 years. They also include about 40,000 asthma emergency room visits, 3,000 new cases of asthma in children, and 29,000 preterm births, which is of course a major health risk for children. Another very significant impact is increased work absence or sick leaves, which would amount to about 20 million days in total over 30 years, so a major economic cost as well. And one really concerning thing about air pollution is that it also makes people more vulnerable to the COVID-19 disease. That's already true in Pakistan right now, that the high levels of air pollution in the country are already putting people at more risk. That's because air pollution is a major risk factor contributing to the most important pre-existing conditions that make COVID-19 more dangerous and more deadly. So, for example, for chronic obstructive pulmonary disease, a respiratory disease that is a major risk factor for COVID-19, more than 1/3 of the cases of that disease are estimated to be linked with air pollution in Pakistan. For many other causes like diabetes, heart diseases, stroke, it's around 10%. And it's also notable that about 1/5 of all the deaths from lower respiratory infections, not COVID-19, but the ordinary kind of respiratory infections from pneumonia and so on, 1/5 of those are attributed to air pollution. So that speaks to how much air pollution increases the risk and the vulnerability to these kinds of infections. And I just want to highlight that the trend in Pakistan of targeting a major increase in coal-fired capacity is quite strongly at odds with what's happening in many other parts of the world. So amazingly, there are there are more than 20 countries that have already decided to completely phase out coal-fired power, including 5 out of the 7 G7 economies, the world's leading economies. And one of the key reasons why that is happening is concerns about air pollution and the very tangible impact that air pollution is having on public health. And in some of these places, when they have closed down coal-fired power plants, they have already been able to verify the improvements in public health, like in things like the health of newborn babies and so on. The other really important driving factor in these decisions is the fact that in those countries that have systematically and ambitiously developed renewable energy, including the United States, including in China, including in India, wind and solar are already the cheapest, the most affordable form of new power generation, more affordable than coal-fired power generation. So they are helping bring down power bills and make these economies more competitive. And this is without factoring in the major public health costs, the economic burden from those public health impacts that is associated with coal. So the key findings from our study: Pakistan is already suffering from high levels of air pollution. There is a very aggressive expansion of coal-fired power that is being planned. The planned coal plants and mines in the Thar region would expose 100,000 people to exceedances of World Health Organization air quality guidelines. They would also expose approximately 100,000 people to elevated levels of mercury deposition. And if these plants are built and operated for 30 years, they would be responsible for a projected 29,000 deaths from air pollution. Based on these findings, the recommendations that we have: first of all, the environmental standards for coal-fired power plants in Pakistan are very weak. So there is an urgent need to strengthen and improve those standards and improve monitoring and enforcement of those standards. There is a very strong need to assess and take into account the costs that coal expansion would entail for Pakistan's public health and Pakistan's economy, and consider that if the future electricity needs of the country can be met with renewable energy, that would very significantly reduce those economic burdens from air pollution. And furthermore, given the significant financial burden created by the coal expansion for Pakistan's economy, for the discoms, the power sector, and given the already hazardous air quality, we think there is a strong case to reevaluate and cancel the planned coal-fired power expansion, especially given that there is currently more than enough capacity to meet power demand if the current capacity is fully operated and made available. Thank you so much.